piece will be mine covering the introduction, and I'll also be covering a little bit of the overview of the RCM program, and then I'm going to pass it along to Greg to get into the details and the specifics of what they will be offering. So billing your way, there's basically three choices when you're going to be looking at billing and using Amazing Charts. The first one that's popping up here is we have about 100 custom interfaces to connect Amazing Charts with third-party software that people would be using in their own office for their billing needs, various practice management softwares, some clearinghouse portals, and such. This would be using Amazing Charts along with something else that's not Amazing Charts to get your complete needs done. The analogy I give for this is back in the day, for any of the people that are my age, when you'd connect multiple components on a stereo, you might have a Sony platform, you might have a receiver that's made by Sanyo. You have to connect those and get them to work together. And that is what those interfaces would allow you to do in using two foreign softwares and combining the efforts as one. The second option that we have for billing your way is the Amazing Charts Practice Management. With the Amazing Charts Practice Management, it's a fully integrated service. It's one in with Amazing Charts. So you would have a new icon within your Amazing Charts software that says ACPM. With it being the same software, it's going to eliminate double entry. It's bi-directional. Any changes that you make in one will appear in the other. Now, both of these things that I've gone over, you notice that I'm saying you will and you need to. Whether you're using a third-party practice management or our practice management, the billing services are going to fall on you as far as the responsibility for submitting claims, getting them paid, doing follow-ups, figuring out why a claim might have been denied or rejected. And then the third option that we'd be offering would be the complete revenue cycle management. Now that ownership is no longer you, it becomes them. So with the practice management, you're basically getting a toolbox, and you're going to have to figure out some do-it-yourself ways of getting things done. If you don't have somebody in the office that is a biller and has billing knowledge, I would shy away from engaging in a service like that. You've basically gone through all of the encounter, everything with the patient. The only thing left to do is to get the money that you guys in the practice deserve. I would trust that in the hands of somebody that knew what they were doing. If you do have a biller in your office, practice management option would be something that's a viable solution. But if you don't have somebody that has that experience, that's when you would look at revenue cycle management, and basically you would take the stresses off of your office and allow somebody else that this is all they do and they're experts at it to follow up on your bills to make sure that the claims get paid on the first submission so you're not chasing things around. So when we put together this engagement for the revenue cycle management, there's a question of how are we going to go about it, who are we going to use. Part of my role with being in charge of business development has been managing our partners throughout the years. And some of you that have been engaged with us for quite some time might remember when we used to have a handful of billing partners that you could come to us and we would let them basically bid on the business with you. We vetted them. We made sure that we had good feedback from clients. And then down the road, we started realizing a lot of people wanted this full cycle where they were just dealing with basically one party to handle everything. So at that point, we needed to make a decision of how we're going to go about doing this. We need to select somebody who we trust, who's been working with us, who knows our software. And we made the decision to go with PGM out of all of those billers that we were using with. Physicians Group Management is local. They're out of New Jersey. Their home base. We're in Rhode Island, as many of you know. So having them here, us there, has become very easy. Making the decision to go with them was based primarily on our customer satisfaction levels. Of all the 5 billing partners that we had, PGM was the one that we did not receive any complaints about. We actually received letters when some people may have closed the office to let us know, hey, we really appreciated the billing service. I hope that you can let them know that us closing the office has nothing to do with them. The doctor just decided it's time for him to retire. All of these slides that you're going to see in this presentation will be sent to you as well as to all the other registrants for this webinar. So some of them we might breeze over and not read every word that you're going to see on there, but you'll get copies of all of these so we can keep the time a little more manageable, and that way we can leave a little bit of time for questions and answers at the end. So with that, I'm going to pass it over to Greg. We're going to get into a little more details about the revenue cycle management services.
Thank you, Adam. Appreciate your time today. We understand how busy your schedules are, so we're thankful that you were able to come join us for this webinar today. One of the things we wanted to start with when talking about revenue cycle management was to give you a little bit of an overview of what we consider the optimal practice workflow or physician office workflow. And the office workflow really starts from the moment that the patient calls up and says, I need to see the doctor. We look at it in really two distinct sections. We have front office functions, which are the functions that happen in your office and are directly related to patient care. And then we look at what are called back office solutions, and those are the things that happen in our office, and that's basically us managing the insurance billing and the collection piece. So if you look at that, we've got new patient registration, which is a critical piece, obviously, of any new patient coming to the practice. You want to make sure you've got insurance information, correct demographics, etc. That patient needs to be scheduled, and then that patient needs to be seen, diagnosed, and treated. So those are all the front office or patient care functions that typically happen in the office, and those are managed through the EHR software, through Amazing Charts. Where we come in is on the back office from a revenue cycle management perspective, and we basically take that claim and take responsibility of that claim from the moment that you sign off on that clinical chart or that treatment plan and move it over to the billing queue. That's when we take responsibility of it. And if you look at some of the tasks within the workflow, we manage the claim scrub or submission process, which is a combination of exporting the data from the EMR into the practice management system, reviewing the claims for obvious errors and omissions, and submitting the claims through the clearinghouse. We also post all the payments. We manage batch payments. We verify the accuracy of those payments against your charge master, and we update the PM system with your payments, basically posting them to the patient account. We also manage the denials, contacting insurance companies, managing dispute resolution, inaccurate payments, short pays, etc. And then through our software, we manage the financial reporting that you're going to need as a practice owner to manage your practice. And you can see, again, the systems are kind of laid out, the steps are sort of laid out, but the bottom arrow is really the system/labor requirement, and that really kind of dictates what software you're going to be using for that, or we're going to be using for that, and then who's supplying the resources for that in terms of staffing, etc. So if you look at the bottom under capability matrix, under the AC EHR platform, you've got a green bar, and those front offices are managed. And then if you look at the AC RCM, you can see those green bars. When you put those two pieces together, you've got a total workflow solution for your practice where all of the capabilities and all of the functions are managed between the front office and the back office. A little bit about PGM. As Adam mentioned, PGM was one of the billing partners for about 8 years, and we were fortunate enough and honored to be selected as the exclusive provider for revenue cycle management within Amazing Charts. But a little bit of background on us is we've actually been in business since 1981, leading provider of medical billing and practice management services and software around the country. So we've got a lot of experience doing this. We actually started back in 1981 as the faculty practice of the New Jersey Medical School. So we've got a lot of experience managing physician billing Over the years, we've expanded into facility billing, laboratories, etc. But our core competency remains physician practice billing, medical billing, and managing small to mid-size primary care, family practice, but also specialty practices. We're going to get into that in a little bit as well. The solution that we offer is a combination of really best-in-class software and what I like to think of as world-class service. Our proprietary cloud-based billing software fully integrates with the EHR, with the Amazing Charts EHR, to provide you a complete revenue cycle solution to manage your billing, data migration, and claim submission, and ultimately to get you all paid for the services you're providing. A little bit about our scope. We have a nationwide presence, currently operating or managing clients, I should say, in about 38 states. Those clients include solo practices, large multi-specialty group practices, large facility practices. We manage about 30 different specialties. And if you see, over the 8-year relationship that we've enjoyed with Amazing Charts, we've been fortunate enough to provide services for about 300 practices and collected in excess of about $400 million in receivables for those practices. So if you look on the right, that's a short list of some of the specialties that we do manage, but there are others as well, and we'll continue to grow. So hopefully over the next coming months, some of those blue states will fill in. So I want to talk a little bit about our solution and how it adds value to your practice. We look at our value proposition as increasing practice collections and lowering your costs, and we do that by utilizing a highly trained staff. These are specialists in their field, sharing resources and IT infrastructure, and allowing you to spend more time, which is, obviously a value add for you with your patient, in the office. If you look at the little table on the right, that's a typical cost analysis that a practice might do to determine whether or not it's cost effective to outsource their billing. And often, if you look at a scenario like this, and this is just a general internal med practice averaging about $310,000 in collections a year, we can offer significant savings. If you look at employee salaries, Social Security, etc., when I talk to doctors around the country and they're doing their cost analysis to determine whether they should keep it in-house or bring it in-house, the first thing you go to, logically, it's the largest percentage of the expense, is to look at employee salary, Social Security, benefits, etc. And that represents about 77% of the overall cost. But what a lot of physicians don't do when they're doing this analysis is to look at some of the other costs. Hiring and training, office space, IT equipment, postage. Every time you send a statement to a patient, that costs 50 cents plus labor. So all of those factors contribute to the total cost of billing. And again, when you sort of factor in just an average salary of a billing person, and this is representative of a single practitioner with one billing person, we can offer some significant savings. Plus, you're getting the expertise of, again, that highly trained staff, all of those shared resources, and the depth of knowledge of Amazing Charts and PGM working together to manage your revenue cycle. What I would do is I would encourage all of you, like Adam mentioned, you'll be getting this presentation after the webinar. I would suggest, if you're interested in RCM, to go through this analysis yourself and see, where you stand in terms of your total cost of in-house billing. It can be an eye-opening experience to a lot of practices, so I highly recommend you do it. What's interesting too is that our costs your costs are proportionate to the practice's income. So we're on a contingency-based fee. If we don't get you paid, we don't get paid. So we are aligned with your practice. We partner with your practice to make sure that we're maximizing your revenue, maximizing your collections, getting you paid as quickly and as as best as possible, maximizing your reimbursement. And it's not uncommon when we take on a new client for clients to see increases over the first few months of 15 to 20%. That's usually due to increased follow-up. One of the most common issues I hear when I speak to physicians around the country is that their staff doesn't have time to do accounts receivable follow-up or insurance follow-up. When we take over a practice, we aggressively go after your AR and management of your current billing, so that we typically see an increase in collections within the first 6 months of coming on service with us. This is something that we feel very strongly about and we're very proud of. Amazing Charts AC RCM has made the decision that we want to utilize an American staffing model, an onshore staffing model. There are a lot of choices out there for you for billing services. We have been very successful managing our staff here in the States, not offshoring our revenue cycle functions. And we feel that it gives us an advantage because it allows us to monitor and truly measure how well our people are doing. They're all located right here in our office in New Jersey. So we have the ability to monitor them, train them, vet them, obviously, and make sure they're maximizing what they're doing for your practice. Again, standardized hiring practices, consistency throughout. We actually do aptitude testing. Many of our account representatives, when they come to us, have 3 to 5 years of billing experience already. We look for people who've been in the industry when we bring them on, and we have a philosophy of promoting from within. So many of our managers are people who've been in the trenches and done the work, have managed payment posting, have managed revenue cycle, and again, many of our reps are AAPC certified. When you work with AC RCM, we get this question a lot. One of the biggest things is that you get a designated account representative over here in our office, and basically that becomes your point of contact for your practice. Typically in the practice, there's a point of contact for us to reach out to, and those two people, whether it's your office manager, whether it's your front end person, your account representative here at AC RCM and your office are going to be very close. They're going to talk a lot. We believe in communication. We believe in the fact that this is your billing. These are your patients. This is your revenue. And to that point, there's no reason that there shouldn't be tremendous amounts of communication between the billing office and your office, so that you have an understanding of what's going on with your practice. Too often I hear stories from physicians I speak to where they say they're with a third-party billing service, and I ask them what software they use, and they say they have no idea, and I ask them what reports they look at on a weekly basis, and they say none. And we don't believe in that being any way to manage your practice. We want you to have access to the data. We want you to be able to have the analytics, and we're going to make sure that you've got access to the software so that you can measure your practice's performance over time. So I wanted to go through a little bit of just we talked a little bit about the physician workflow. This is really the life cycle of a claim. So we wanted to kind of go through that with you a little bit so you can understand what it is that we do once you sign off on that chart and that claim moves over to AC RCM for management. The first thing we do is actually during setup, we do a practice evaluation where we actually look at your current coding and just validate that you're optimizing your reimbursement. That's done during setup. Subsequently, as files come over to us for billing, and that's usually done, it can be set up on an interval. It's an automated process. So as we're looking at your batches, we're validating your coding to make sure you're not using expired codes or inaccurate codes. The data is seamlessly imported into the RCM system using an HL7 feed. So what that does, if any of you are currently with a third-party biller, you'll know most of the time, or frequently I should say, you have to actually include sending your data as part of your day-end close. Just like you're, emptying the cash register and shutting off the lights before you go home for the night, you have to physically push that data to the billing company. We've eliminated that and automated that process. So the way our system works is there's an interface built between the practice management software and the EHR, and that interface will actually sweep into your system on a preset interval, and that's customizable to the practice, and extract the data that we need to bill. So there's no more of you having to worry about that. Again, that's one less function that you have to manage at the practice. Once those billing badges are uploaded into our system, we balance them out, we scrub them for errors and omissions, and then we process them through the clearinghouse for payment into the carriers. Now, the clearinghouse, if you look at the next slide, the clearinghouse is going to do a couple of things. The clearinghouse is going to add another layer of claim scrubbing to the claim review, and it's going to reject anything that's questionable or not accurate, which gives us the opportunity to fix that claim immediately. So we call that a first pass rejection, and we actually work on first pass rejections within an hour or so of submitting your batch. Our goal is to get your claims into your carriers within 24 to 48 hours of receipt of them. So if something's not clean, that gives us the ability to go back to you and figure out what's wrong with it, if we need information from you, if we need to go back to the patient for a valid ID number, whatever the case may be, we'll manage that process. For payers that don't have the ability to accept electronic claims, we do manage a hard copy claim submission process for our clients. We typically see that in workers' comp and some of the smaller third-party payers who aren't set up for EDI accepting. The next thing we provide is the payment posting. So we will typically post off your electronic remittances, ERAs, or your hard copy EOBs. We will set up every client as part of our service with access to a share file so that EOBs can be scanned to us in a HIPAA-compliant manner, and we will manage those postings manually from the EOB. The ERAs will be uploaded automatically and posted real-time directly into the software. So when we talk a little bit about the software, it is a cloud-based real-time software. So as payments are posted, as charges are posted, your numbers are going to change over the course of the day. As we take, when we bring in a billing batch, your AR is going to go up, and then when we post payments, your AR is going to go down. So it's a dynamic system, but it's real-time. It's got real-time updating capabilities. So you're going to see a constant, up-to-date status of your accounts in your practice. We also manage the payment posting for patients. Customers are provided the option to have payments sent directly to the Amazing Charts location where the billing occurs. In that case, we would be able to make deposits for you if it was a local branch in our area. If not, we typically have those payments sent directly to the practice, and those payments on a patient, for the patient portions, will be directly deposited at the practice level. Either way, the statements that go out to patients have our 800 number on them, because we want to manage or actually eliminate the burden of managing those patient calls and take that administrative burden off the practice. So when a patient gets a statement and they have a question on the statement or the balance, they're going to call the 800 number, and it's going to ring directly to your dedicated account representative, who's going to be able to pull that patient up in the system and be able to respond to their inquiry and hopefully secure payment for you right at that point. Our system is going to allow us also to track your claims. What we're going to be able to do is, through statusing your claims, we're going to be able to manage your unpaid claims. One of the things, another big issue that we hear all the time when we talk to physicians around the country is that, again, they don't have the ability, or someone in their practice doesn't have the ability to do follow-up. We do the follow-up. So we're going to aggressively go after your unpaid claims. And we're going to do that by statusing your claims, running your accounts receivable on a monthly basis, and physically calling or using payer portals to status each of those claims to find out what's going on with payment, when can we expect payment, in what amount, etc. All of that information is documented in the system so that if you ever have a question, you have complete transparency into the software, and you can look up that patient and find out why that's not paid. So we're going to manage that claim tracking and aggressively go after your unpaid claims. We're also going to manage your denials, which is another critical piece of revenue cycle management. Typically when we receive an EOB or an ERA from a payer, we post your payments, and then the next piece of what we do is immediately look for what we call zero pays. Zero pay could be a denial for any number of reasons. It could be applied to deductible. It could be no out-of-network benefits. It could be patient maxed benefits. It could be policy termed. Each of those reason codes will set us into our next step. So we'll manage that whole process. So depending on the denial code, we'll determine our next steps. But again, we're going to aggressively manage that process. If it's a policy termed, we're going to immediately call the patient and find out who their new insurance is. We're going to update it in the system and then make sure that you have that updated information in your EHR as well, so the next time that patient comes in, you're going to have the correct information. And then the last piece of what we do is balance billing the patients. What we typically do is work with our practices during setup to create a billing profile. We want to act as an extension of your practice, so we're going to basically pursue your patient balances in accordance with your compliance plan and your philosophies for your practice. We'll manage the statements, we'll manage the phone calls, and again, everything gets directed right back to your dedicated account representative here at AC RCM. Again, cloud-based reporting, I would suggest for anybody who's interested after the call, I'm going to, at the end of the call, we're going to have some contact information. We are more than happy to do a system demo of the software. So if that's something that you think you're interested in, we encourage you to reach out to our sales team, and we'll be happy to set that up. But a little bit about the cloud-based reporting. Our system provides advanced financial and performance analysis designed to increase visibility into your operations. So one of the things we're going to do is give you and anyone in your practice who needs it access to the software so that you can look at your collections, look at your reimbursement by code, look at your reimbursement by payer. If you've got multiple providers in your practice, you can look at reimbursement, collections, etc. by provider. If you're performing services or seeing patients in multiple locations, we have the ability to parse that out so that you can look at how much business you're doing in one hospital versus another versus another setting. We think there's a high degree of analytics that's here. And the other thing too that's going to be important is over time you'll be able to benchmark your practice against other practices of similar size, scope, and specialty to determine how you're doing, not only as a practice by yourself, but also against the larger population of patients, clients rather, within the software. You're going to get a full, robust reporting suite. We've taken a little bit of a different approach to reporting in our software. Most practice management software has hundreds of reports. An accounts receivable report by insurance, by payer, by patient, by date of service are technically all the same reports. They're just different sorting and filtering features. So what we've done is we've eliminated a lot of the reporting, streamlined the menu, but we allow you to do a lot of on-screen filtering and reporting, which will allow you to get to the data you need on the computer, on the desktop, and then export the final results to a PDF, text, or Excel file for any further manipulation that you may need. So in summary, we kind of put this slide together because that's a question that I get a lot. What makes us different from other billing companies? I think a time-tested, proven process. We've been doing this for 35 years. A fully integrated, real-time, cloud-based system that truly interfaces with your Amazing Charts EHR is a huge benefit for your practice and for the data integrity. Full financial transparency. Again, I can't stress that enough. This is your data. These are your patients. This is your revenue. We approach it in that manner. So we don't lock you out of reports. We don't send you what we want you to see. You have the ability to go into the system and run whatever report you want at any time interval you want. Again, U.S. owned and operated. Your representatives will be here in the States. I think when you go through your cost analysis, if that's something that you want to do, and I encourage it, and I'm certainly more than happy to help you go through that, you'll see that there is a high value added proposition to what we can offer. And ultimately, at the end of the day, it all comes down to have we improved your collections, and we've got a track record of doing that. So ultimately, the goal is to get you paid for the services you're providing and the patients you're seeing. So I'm going to go through these real quick. These are actually on our website. These are a couple of case studies from practices that have been using the service. This is Private Physicians Medical Associates. There's another one here for Bay Area Quick Care, which is an urgent care based in Texas. I'm not going to go through them, but these are on our website. Please feel free to visit our website and read through them. Obviously, references are available upon request if this is something that you feel strongly about and you want to explore it a little more, and we can go from there. So before I open it up to questions, I just want to make sure you all have our contact information. 866-382-5932 is the sales department. Option 2 will take you right into RCM sales, or you can email us at sales@amazingcharts.com. So for anybody who wants to ask a question, when you logged on to the seminar, there was actually a chat panel, and you can actually type your question in, and we can go through it right there. Okay, I have a question here. How is AR follow-up handled? We talked a little bit about that. Basically what happens is your dedicated account representative will run your aged AR on a monthly basis, and we will begin statusing claims that are over 60 days old, or in that 60 and over bucket. We will basically touch every claim. We get this question asked a lot. What about my low-hanging fruit? What about my small claims? Will you chase a $5 claim? Will you chase a $10 claim? The answer is yes, we absolutely will. Again, we're incented to collect as much as possible because we are a contingency-based service. So if I don't collect your money, we don't make money. So our incentives are aligned. But we will run that report. Your rep will run that on a monthly basis. We have accounts receivable follow-up representatives who will status those claims. We spend a lot of time on the phone with the carriers. We use their specific insurance claims portals online to online status claims, and we'll manage them. Again, our job is to hold the insurance company's feet to the fire to make sure you're getting paid for your claims. Here's another question. How are practice collections defined? That's a great question. So the way we typically look at it is anything that results in an insurance claim being submitted. So if we process a claim to insurance, collections associated with that claim would be subject to our fee. So that does include deductibles, co-pays, and co-insurance amounts. It also includes if a patient receives a statement but then comes into the practice to pay it, maybe on a subsequent visit, that statement fee would be included in our in our fee. We do have practices that have a large book of private pay or cash patients. Maybe these are patients that are in between insurances, maybe or in between jobs. Maybe these are patients who don't have insurance. Maybe you know, you have a lot of private pay in your area. If there's a claim not being processed to the insurance company and we don't touch it, that does not ever get included in our fee. So it's only if we process the insurance claim. Any other questions? Someone just sent a question, would we do a demo and how long is setup time? So yeah, I mentioned earlier, we're more than happy to do a demo. Reach out to us at the 866-382-5932 number and speak to one of our representatives, or email us at sales@amazingcharts.com, and we'll be happy to get you on the schedule to do a demo at a time that's convenient for you and your practice. Often there's multiple people in the practice who need to sit in on it, maybe the office manager, maybe the physician. So we typically, you know, do our best to accommodate you. We do a lot of them on lunch breaks, etc. So we're more than happy to show you this system. Setup time varies. To implement the software, it takes roughly about 30 days. We have had implementation go extremely smooth, and we're able to get clients up and running in 2 weeks. But typically, to be safe, implementation and a go live would take about 30 days. So somebody asked about printing statements at the office. Yes, that functionality exists. So you will have this software up on your desktop, and as patients come in, you have the ability to go into the system, and if they say, you know what, I got a statement in the mail, but I forgot it, can I pay you? Absolutely. You can go pull up their ledger, pull up their statement, and print them a copy for a receipt. We have the ability to either allow you to post that co-payment, patient payment, whatever that may be, into the software, or you can send it through the share file and we'll manage the payment posting process for you. But yes, you can print a receipt or a statement right at the office for the patient. So somebody mentioned that they're a podiatrist, and can we manage revenue cycle management for specialists? And yeah, absolutely. If you remember from one of the earlier slides, we have a very large client population in internal med and primary care, but we also manage about 38 different subspecialties as well. Podiatry, cardiology, pulmonology, endocrine. We've got a lot of clients. And again, as you go through the process, if this is something that you're interested in, and we hope you are, we can certainly help you with references so that you can speak to some clients who are using the service within your specialty, so that you can ask questions and make sure you're vetting us properly. Any other questions out there?
And in the event any of you guys typed in a question that somehow didn't pop up on our screen, it will show up at the end of this webinar. So we'll be reaching out to you one by one as well, people from my sales department, just to follow up on the webinar, see if there were any specific questions that you'd like answered regarding your practice. And again, we'll also be sending out this entire deck of slides, so you'll be able to take your time and read through each one of them at your own leisure.
Adam, that's it for me. I don't know if you've got anything else for the group.
No, I guess if there be no other questions that popped up, like I said, we'll respond to any that do come in one-off, and you should expect to get a copy of these slides probably no later than the beginning of next week. And I will have a member from our sales department follow up with you directly just to see if there is anything that you need, or if you'd like to see a demo one-on-one and work with one of the billing specialists to see the features. So I appreciate your time. I appreciate your time as well, Greg. Thanks for delivering this to our clients.
My pleasure. It was nice speaking with everyone.
Okay. Thanks, everybody. Everyone have a great day.